Hi, everyone. Thank you for joining us today. As we're filing in today, I want to welcome you to our webinar. My name is Marche. I'm the webinar director here at Advice Chaser, and we have a really interesting and I hope very informative webinar for you here today. Before we introduce our speaker and get started, I do need to do a little bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. Today's presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by presenters are their own, and however true, funny, or interesting, are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. Well, we are thrilled to bring you today's educational presentation. Attendees are muted, but we do encourage you to ask questions using the chat box, and we will address those during the question and answer period at the end of the presentation. If you ask a question in the chat box and we're not able to get to it, go ahead and leave your contact information as well, and we'll make sure someone reaches out to you after today's event to address that question. Again, we want this experience to be as educational as possible, so please don't hesitate to ask for clarification or expansion of the material. I'd love to introduce you to our presenter today. Annalee Kruger is the founder and president of CareRight Inc., the concierge of senior care planning. CareRight assists families in navigating the complexities associated with the aging process by managing crisis situations, developing a proactive aging plan, facilitating family meetings, and providing needed support to struggling caregivers. For Annalee, providing proactive senior care planning to families is more than just her career, it's her passion. Annalee has spent her entire career in the senior care industry and has become a nationally recognized expert in the field of senior care planning. Annalee is the author of The Invisible Patient, which outlines the emotional, physical, and financial toll experienced by family caregivers. Also, Annalee is the founder of Care Crusade, a national campaign for family members with loved ones in healthcare facilities to improve the quality of care. Annalee, I am so excited to have you here, and I'm going to go ahead and turn the time over to you.
Thank you, Marche, and thank you everyone for coming to our webinar today. Let me get this all set up. And all right, okay. So I'm Annalee Kruger with CareRight Incorporated. Today we are going to talk about how to hire a caregiver and some food for thought, things to think about, and just, awareness so that you can make informed decisions as family members or people who are working with families with aging loved ones. So how to hire a caregiver. This is why this topic is really important is, well, for every single reason, but number one is this is one of the top 10 biggest questions I always get asked. Well, how do we know what kind of caregiver, what can they do for us? How much will it cost? What can we expect? Those kind of things. What if we want to hire someone privately on our own? What are the pros and cons of that type of decision? So this is actually, we have a whole family meeting when we do an aging plan with families. We have one whole family meeting about aging in place at home, aging in place at home, and the caregiver issues that we are all presented with now, especially since the pandemic. So we are going to cut through and talk about some of those topics through this webinar. And absolutely, if you have questions or want to learn more about this whole topic or what is an aging plan and why is that important so that you and your family can have a successful caregiving journey, you'll have my contact information as well. So why your loved one may need a caregiver. Family cannot provide adequate caregiving on their own, or you have been providing the care and you need a respite, you need a break. One of the challenges that we have is that, families, when I first started 30 years ago working with families and aging planning, the adult kids all lived near each other and they all lived near mom and dad. And so when we would have a family meeting at mom and dad's house, the kids could easily gather around the kitchen table and we could talk. What's working well? What's not working well? What are your goals? What kind of care do you need now? And what kind of care do we anticipate that you're going to need? Not everybody in a family is wired to be a family caregiver. Maybe they don't have the relationship with their parent that would warrant them wanting to be a caregiver and taking them to the bathroom or taking off work to take your loved one to a doctor's appointment, or paying their bills. Maybe not everybody has that type of relationship or personality where they can do that or they want to. And as our parents age and they get more medically complex with weight loss and falls and skin breakdown and skin sores and pressure sores, not everybody feels comfortable providing like that type of nursing care, basically, on their loved one or for their loved one. So, and for those that are doing all of that work, you will need a break and you will need an aging plan and you'll need more help. I always say to families, no one gets through this aging journey unscathed. Mom and dad don't get through this aging journey unscathed, and neither do you as adult kids, because we know that 58% of the time, adult family members will end up thrust into the role of family caregiving, whether it's because mom or dad had a stroke, their dementia progressed, or their Parkinson's progressed. And now you went from being a son or a daughter to now being a caregiver. So that's why it's important that we talk about what can a caregiver do and what can we expect, what type of tasks and services can they provide, so that for those of you who just want to be the son or the daughter and not the full-time caregiver, there's options for you out there. It's just, we just need to sort them out for you. So a lot of times when I ask moms and dads, what are your goals as you age? What do you think they say? Well, I want to age in place at home. But then the second thing that they tell me is, but I don't want to be a burden on my kids. But guess who is calling me for an aging plan or calling Care Right for an aging plan? It's always the adult son or daughter, because they have been thrust into the role of family caregiving and they're burned out. And it's not the right fit for them or their families anymore, or their finances. So when moms and dads say, as cute as that little lady is on this slide, when they say, "Oh, honey, I just want to stay at home," that's a big goal, because the cost of care has doubled since the pandemic, and it is very, 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 very difficult trying to find reliable, quality, trained caregivers. So it's a challenge. Your loved one needs help with activities of daily living. Those are called ADLs, activities of daily living skills. So the bathing, dressing, toileting, grooming, medication management, and administering medications. All of those tasks are difficult to do, and especially when it's a long-term situation. It's one thing to be a caregiver if your mom has a broken hip and you know that in 4 to 8 weeks, she's going to likely be back up and running on her own, not running probably, but back up and working, doing her own self-cares. But it's a whole nother thing if your loved one had a stroke and you're doing all of these ADLs or activities of daily living, or your loved one has dementia and they're just simply not able to do things on their own, or they just need the constant care and supervision and reminders. It gets very overwhelming very quickly. The other reason why your loved one may need a caregiver is just companionship. We found during the pandemic, and no one should be surprised by this, but when you force isolation on people, it's just common sense that you're going to see more confusion, more anxiety, and more depression, because people aren't meant to be isolated like that. So a lot of our seniors really slipped a lot mentally and physically during the pandemic. And part of that is they didn't have the companionship. If you're a family like ours, we are very close knit. So someone's always engaged with our parents. And when you can't fly back and forth to go see your loved ones, or drive back and forth to go see your loved ones like you normally would, that's definitely impacted their quality of life and their health, and yours too. The different types of providers, there's a whole bunch, so we're just going to go over some of them on this slide. Home care companies, so like the companion care companies that can help with those activities of daily living and that companionship. Maybe your mom or your dad, just, or you, if you're listening to this and you're in the situation where you're like, what am I going to do for home care? Maybe you just need someone to come and play cards with you and keep you company, take you to your doctor's appointments, help you with your showers, or make sure that you have your meals or meal management or shopping for your groceries. Those are the types of things that companion companies can do. So there's kind of two kinds. There's home health care, which is more the skilled need. So if you need like physical therapy, occupational therapy, a nurse to come and monitor your medications, monitor your blood pressures or your diabetes, or wound care, that would be home health care. That's a skilled need that insurance pays for if you have a doctor's order. But companion care is non-medical, so they can't administer medications. They can only do medication reminders, as an example. They can't set up your medications. They can't do treatments like skin treatments. They are companions and companions only. Huge cost difference as well. So geriatric care managers are usually nurses that can come into your home and, evaluate how you're doing, coordinate your care, all of those doctor's appointments that you have. That can get really overwhelming if you have multiple doctors and multiple doctor's appointments that you have to get to. A geriatric care manager can help you with that. And then they can also either drive you and or meet you at the doctor's appointment and go in with you as your advocate and take notes and make sure that questions and concerns get addressed. One of the values, there's many values of working with any of these types of professionals, but one of the value of a geriatric care manager is that doctor appointment advocacy. Sometimes seniors they don't ask questions, or they don't get the time that they really should with their physician. The physician will just kind of look you up and down and say, yep, looks like you're doing okay, Ethel. I'll see you back in 6 months or whatever. But if you have an actual advocate or your family can go with you, that's when the questions can come. Well, dad's lost 4 pounds, in the last 6 weeks. What should we do about that? Having someone there as an advocate will help you have a much, much better care outcome. Cash only hires, there's like 2 or 3 slides about the cash only hire consideration, but sometimes people don't want to go through a home care company for whatever reasons that they have. So they want to hire someone privately, or maybe they have a relationship with a neighbor who's a retired nurse, for an example, and the retired nurse wants to help. And so they work out an arrangement. So there's cash only hires that you can think about too. There's some pros and cons about that. Adult day programs or adult day centers can be a really good solution or a good option. Those are really affordable depending on where you live. It's anywhere from $18, $22 an hour. But so it's cheaper than home care or companion cares, and you get to be around other people like you that have the same disease that you have or similar disease process that you have. And they have activities, they have a nurse there to administer medications. You can get a bath there. They have a shower there, so that if families are having a hard time getting their loved one with dementia bathed at home, you can just upgrade your adult day program package, and that can be included in the package, which is a huge, huge, huge win for you as a family, and for your loved one, because then you're not the one having to give the bath. Commission-based placements, those are what we call placement agencies. Those are transactional. We'll talk about those here in the next few slides as well. So those are different, those placement companies aren't necessarily a care provider. They are just a placement company. So we'll talk more about what that means. Challenges with hiring a caregiver. So before the pandemic, the home care companies, because of staffing issues for many, many years, and the shortages of healthcare workers way before the pandemic, they all shifted, or pretty much all of them. I shouldn't say all, because I'm sure there's one or two companies out there that might still offer a 1 or 2 hour shift, but you pay premium prices for that. And that's how they used to do it. But it's hard to find companions. And so most home care companies have a shift minimum, and it's 4 or 5 hour shift minimums. Or what they'll do is say, well, you have to commit to wanting to be a client for 28 hours a week. So the reason is because we have a very small applicant pool, and the pay isn't great. Some of these home care workers are making anywhere from $11 to $13 an hour, depending on where you live. In other areas, the home care companies bumped up the pay, but that doesn't mean they bumped up the pay to the worker, which then of course means that you have to pay more. So I have clients that are paying anywhere from $50 to $60 an hour for a companion to come in, because it's such a shortage of healthcare workers. These home care companies are having to pay more. But the other thing is that to get people to come to work or to apply for these jobs, they're offering like crazy sign-on bonuses. So the home care companies' costs increased to try to be able to get workers to help you. So the applicant pool is minimal. During or since the pandemic, because there's such a shortage of workers, it's just been very difficult. I have many clients that are on a waiting list for home care companies, so that when that home care company gets more employees, then they can serve these seniors. But that gap in between is a challenge for not only your parents, but also you as a family caregiver, because someone has to fill that role as a caregiver until the home care company can find staff. Unfortunately, what a lot of home care companies have had to do is they've lowered the bar of who they would normally hire, because now they just need bodies. So you have to be healthcare now is very, very different. And that's why you need to work with a professional to help you sort out what some options can be for you. And that's what we do. The drug screen and the criminal background check, that's really important. If you hire someone privately, like your neighbor lady Nancy, who wants some hours and wants to help you, you just need to make sure that who is coming into your home that you bring in out of your own pocket is someone that you really, really do trust, and someone that you really, really do know. At least with a professional home care company, most of them do the drug screen and the criminal background check. Your loved one may be resistant. This is a whole nother webinar on its own, but that's why there's been, yeah, Marcia's like, yeah, I know. Because this is often the case. Mom and dad want to age in place at home, which is great, but then they have to be willing to do what it's going to take for them to age in place at home, right? So that may mean that we need to implement cameras so that we know that you're safe. That might mean that if you want to age in place at home, you should expect a lot of different care workers coming in and out of your home. And as you decline and you need to have physical therapy and occupational therapy and a nurse or hospice coming in, the biggest complaints that my clients who chose to age in place at home are these. Number one, the traffic, the people coming in and out of their house makes them very, very uncomfortable, because they don't know who's coming in when, and they can't keep everybody straight. They're like, okay, are you with hospice or are you with home care? They can't keep everyone straight of like, who are they there and what are they there to do? When you decide to age in place at home and you need 24-hour care, you're going to end up with whatever caregivers are available to come help you. So home care workers choose which clients they want to work with. So that 4 to 5 hour shift minimum, if that care worker has to drive an hour to come serve you for that 5 hour shift, they're not going to want to do that. They want clients that want 8, 10, and 12 hour shifts. And this is why, because depending on where you live. So for example, in the Naples market, there's a lot of wealth in the Naples market. Well, companions don't live in these types of cities, right? They don't live in Naples because they can't afford to. So if they pick up a Naples, Florida client, they might have to drive 45 minutes or an hour to get to you. And that's why you get upcharged, because that costs the home care company that much more if they have to pay them to drive over to you. So, so the traffic of coming in and out of your house, if you have a 12-hour shift and that caregiver is a no-show or they call in sick, you may end up going without care for that 12-hour shift, or you're going to end up with multiple people coming because they'll say, okay, we have a 12-hour shift that just came open. Who can help out and fill this shift? So you might get someone that can come in and fill in for 2 hours, and then someone else fill in for 3 hours, and someone else fill in the rest of the shift because they have to piecemeal it together, provided they even have someone that they can send. So when we talk about your loved one may be resistant to bringing in care, they need to know that if they choose to age in place at home, they're going to have to really adjust their expectations of what that really means, and be open and coachable to different solutions so that they can age in place at home using home care, cameras, fall pendants. We can load anyone up that wants to stay at home with services and products and solutions to help them, but they need to be open to that. Sometimes they aren't, and so they fail on their own. If they fire the home care worker, which happens a lot, if they fire the home care worker and then the home care company is like, look, clearly your mom doesn't want services, so there's no point in trying to keep sending people out, because they have a whole slew of seniors who need help and want the help. So that's why these kind of conversations, it really is prudent to have a neutral third-party person help you facilitate these family meetings. So research your options. Every county across the country has an ADRC, an Aging and Disability Resource Center. Now they're just a resource center, right? So you're going to get a bunch of brochures and all this kind of stuff, but you still need someone who's going to help you, sort all this out. And you can talk to your doctor about it. They're not always hip on making referrals because they just kind of stay in their lane. Local hospitals may be a resource for you, especially if you're in the hospital and they're working on your discharge plan. But one of the reasons I built Care Right is because none of these providers here are actually working together. So they piecemeal it for while they're working with you as a patient. But then when you leave the hospital, you're kind of on your own. And so if you don't have home care coming in or a care manager coming in, that's why 48% of seniors, when they discharge from hospitals, they fail, because they don't have those supports in place to be able to follow through with all these upcoming doctor's appointments and changing out their medications and stuff like that. Word of mouth referrals is a way to get find out who might be good. Like, who do you use for your dad? Who comes out to your house for your dad? And so word of mouth referrals are always good. And again, it depends on what kind of care need that person is needing. So a word of mouth referral can be great, say for, John, who's up moving around. He can bathe himself, he can groom himself and cook for himself. He just needs that companion to play checkers and cards or take him to doctor's appointments. But then if you say, well, I want to try John for my mom. Well, what if your mom has had a major stroke and she needs incontinence care and bathing and showering? Maybe, so word of mouth referrals are good, but every case is also different. And these workers have different skill sets too, right? So just know that there's help out there that can help you sort out what some of these options are. There's also major home care franchises all across the country that they have 40, 50, 60, 80 different home care franchises. So you can always look to see if there's one in your neighborhood. How those work is the franchise buys the zip code. So it depends on where you live or where your loved one lives on which franchise company might be able to serve you. And you can do online research, but it's just always better, in my opinion, to work with an actual professional. Just like you probably wouldn't shingle your own house, you would probably hire a professional so that it's done right and it's done faster, right? So this is kind of the same concept of working with someone that can actually guide you through this whole process. How it works with a home care company, say you bring in a home care company, what they'll do is the first step is, okay, mom needs more care, or she needs more companionship at home. She needs help at home. So you find your caregiving company that you want to work with. What they'll do is they need to meet your loved one. So they need to come out to the house to meet your loved one. You'll have to, and that takes about 45 minutes for them to do their intake form, which is basically, what do you want us to do? When do you want us to come? And then they'll take down your credit card so that then they can just auto bill you. So their assessment usually takes about 45 minutes. If you don't live near your loved one, they can send you the agreement, the caregiver agreement, via DocuSign usually, and then you can get started. What they'll do then is, once they get to know your parent, then they will assign a care team to you or to your loved one. They do try very hard to match personality to personality. So, and this is one thing that I capture this when I'm talking with my clients about aging planning is, okay, mom and dad need home care. They need help at home. What kind of personality do you think would be better with your mom and dad? Because if your dad is quiet and reserved, for example, he may not want a chatty Cathy coming in because he'll be annoyed most of the time, right? So they do try to match their caregivers with what your loved one's conditions are. But that said, it's not a perfect science. And because everyone's getting to know each other, you really do need to give that companion a chance to be successful. Give them as much information as you can on what to do, play cards, what does your loved one like to do, and give them a few sessions together or a few shifts together to get to develop that relationship and that rapport. Because when you get the right companions, this is such a beautiful thing when you get the right companions, but sometimes it just takes a few tries and you just have to be patient, or your loved one has to be patient. The other thing home care companies can do is if you do have long-term care insurance or life insurance hybrids, another insurance platform to, offset the cost of care, the home care company will take care of that long-term care insurance paperwork for you. They'll help with getting all the doctor signatures that are needed. They'll send the long-term care insurance company a copy of their license and a copy of the care plan. And every month they'll send a copy of the care plan. The invoice. So that's how that process works. Hours can be increased or decreased as needed, because say you're like, okay, well, mom's barely agreeable to having home care. so you might start out with like that 20-hour minimum or whatever it is that the home care company has. It might be a 28-hour minimum per week shift, or, hours that they need you to commit to. You can always increase it, because as her care needs increase, or as she declines, or as the dementia progresses, you can always increase the shifts, which is really great. So even if you start out with a care plan of 28 hours a week, you can be like, you know what? We didn't realize mom wasn't doing so well at home, and the caregiver really needs more hours because we realize mom can't do her own laundry, or mom's more incontinent than we thought. We can always increase those home care hours. And then some home care companies have a just in case program. Some of them have gone away from this, just simply because with the pandemic, they don't have staff, they don't have care workers just sitting around twiddling their thumbs. They're short of companions. Like I said at the beginning, there's a lot of clients that I have that are simply waiting until these home care companies have companions available to serve them. So now of all times, aging planning has always been important, but I can tell you as an aging planner, it's never been more important as it is now. So inquire about the company's hiring practices. So some different questions you can ask are, how do they recruit their staff? At this point, I can tell you that it's pretty much as long as they pass the criminal background check. that's pretty much what it is at this point. They need bodies to cover these shifts. They do the criminal background check, and some of them do the drug screening. You can ask them if they offer employee benefits, because you want happy workers coming in to help take care of you or your parents. But what kind of employee benefits? Basically, what's the culture like? This is important, are they employees or are they independent contractors? And if they're independent contractors that this company uses, do they have liability insurance so that if there's any injuries or this worker is taking mom to her doctor's appointment and gets in a car accident, what type of insurance do you have to cover so that you as a family aren't put at financial risk of having to pay for things like accidents or work injuries, like a bad back or a trip and fall with that home care worker. Training and education, that's a general question. They're all going to say, well, of course we train our staff, but what the training is, and this is a whole nother different webinar too, but what the training is it's very bare bones. It is brief videos, and then they have to answer questions, and it's not like live, engaging, interactive training. So their training is very bare bones. So I'll just leave it at that. So if your loved one has specific like congestive heart failure or kidney disease or dementia or Parkinson's, you want to try your hardest to make sure that the people that they send out are properly trained. And oftentimes the family ends up having to train the workers on how to take care of their loved one. Accountability. So what do we do? Who do we call if the person is a no-show or we don't like what we saw on the camera? Who do we call? Who's our contact person if there's any issues? And how do you hold the staff accountable if they have no shows or the person keeps calling in sick? What's the plan for that? And what's your matching process? Again, they do try hard. They do try hard to match the right personality with the patient that needs the care. And then the no-shows, again, how do you handle no-shows, and what's the likelihood that you're going to be able to fill that shift if Maria doesn't show up for her shift? They're not going to be able to guarantee you that they'll fill that shift because their workers are already booked with other clients. So inquire about what happens in the following situations. What happens if dad falls in the shower and the caregiver is supposed to be there helping them shower? So what happens about falls? Tell me what your process is about falls, and incident reports. And before I forget, I cannot stress this enough. I strongly encourage, I highly recommend and highly encourage you to have cameras in the house just for your own peace of mind. And one of the reasons is because you do have strangers coming into your loved one's house, but also you may be able to leverage technology in some periods of time where you wouldn't always have to have a companion. So like at nighttime, if you know that your mom is sleeping, you may not need a companion at nighttime, right? If she sleeps through the night. But it also helps you understand what is your mom or dad doing during the day. And that can also help you gauge, oh, we need more home care than we thought we did. So that's just the whole thing about cameras. I can't stress it enough. You do need to let the home care company know that there are cameras in the house though, but they can definitely be a lifesaver. Incontinence during an outing. So normally what they'll do actually is they'll just bring extra clothes or, their incontinence supplies. With my mom, I just had it in a backpack. So I just carried that backpack with me into doctor's appointments and stuff like that. Because nowadays, doctor's appointments, this is a very common thing, the incontinence during an outing. Doctor's appointments, they so overbook that sometimes we would have to wait 2 hours just to get seen by the doctor. And then if the doctor changes medications, then you have to go to the pharmacy. And by now mom's hungry. So mom needs to eat and now she needs to go to the bathroom. So I always just carried like a backpack with her supplies, gloves, butt wipes, and extra diapers, and a couple extra outfits just in case she had accidents. So that's what the companion should be doing too. Transportation, who's going, if you know that transportation is a service that your loved one is going to need, you need to make sure that you let the home care company know that, because they may not have drivers, they may not have people who have valid driver's license. So if you know that transportation is a service that you need, and that comes up during that assessment that the home care worker does. If you're working with me, I already have this all lined out and all squared away for my clients, so that when we do implement home care, everything's all buttoned up already. What do you do in the event of sickness if the caregiver doesn't show up for their shift? Or during COVID, what's your COVID protocol? So medication administration, again, for non-medical companion cares, they cannot administer medications. All they can do is say, Ethel, it's noon, it's time for your pills. We've already talked about no shows, that there is no guarantee that they'll be able to replace that shift or fill that shift with other companions. What's the complaint process? If I have a complaint, there's lots of complaints that come up because of no shows, or the caregiver's not properly trained, or they're sitting on the couch on Facebook all the time or on their phone all the time. Who do I call when there's complaints? Or the caregiver smoking in the house, or whatever complaint it is, who is it that I need to talk to? Are you bonded and insured? That's a great question. Do you have other similar patients that are like my mom? Do you have someone that has dementia, and how do you train your staff specifically? So if mom starts sundowning at 3:00 in the afternoon and gets more agitated and paranoid and restless, which is common with that disease, how are your staff equipped to manage that? So what is your training, and how do they manage that? And then if you suspect mistreatment, what do you do? Like, what is your process for that, and who do I talk to? Obviously, with cameras, you can spot mistreatment right away. And if it's imminent danger, you call the police and have the police come over. That's simple. That's what you do there. Extent of the caregiver responsibilities. What services will they and will they not provide? So what kinds of things can they do? What don't they do? Activities of daily living, bathing, dressing, grooming, meal preparation, transportation, activities, socialization, and then offering respite or a break for the caregiver. So say you have mom and dad. I want to be careful because I know I go off script, so I want to be mindful of your time. But I think that my off script stuff is probably pretty helpful. So I gave up coffee 2 weeks ago. I gave up caffeine 2 weeks ago. And since then I can't talk. So off script stuff I think is helpful. So this is my attempt at trying to be healthier. So we'll see how long this lasts. But respite. So say you have mom and dad at home, say they're in their 80s and dad's been trying to take care of mom, but dad had a stroke and he's got Parkinson's and mom has dementia. They're trying to take care of each other as much as they can, but your dad is going to burn out because dementia never stops. So it's not like your dad's going to be able to, get a full night's rest. And it's likely that, we know that the primary caregiver has a 65% higher mortality rate because they're not getting their own self-care. They're usually losing weight. They're not sleeping well. They're not getting their own medications. They're not taking care of themselves, or they're putting off surgery that they need because they feel like they need to, because they're the primary caregiver. So we know that the spouses or whoever the primary caregiver is, we know that they will get burned out. And I know that because 92% of my clients come to me as totally burned out family caregivers because they don't have an aging plan yet, but they will when they work together. So the challenge with a respite for like moms and dads is that generation in that 80s and 90s and 100-year-old generation, I always say it like this, and I know it probably comes out a little bit funky, but they took their wedding vows seriously as far as like, if I'm not the one taking care of your mom, then I let her down in the vows. And so we really have to work hard at getting through that mindset, because if the spouse is not properly taken care of and we don't have enough supports in place, they will end up hospitalized or dead sooner than the person that they're taking care of. That's just a fact. So no one should ever be surprised if their primary caregiver spouse passes away sooner or ends up in the hospital, because your body just simply cannot be on call or available 24/7 for the needs of what these care recipients need. So the challenge sometimes is having mom and dad agree that yes, it's time, it's time to have a companion come in, but then letting him actually get, sometimes they just have a hard time, like, okay, Maria is here to take care of your mom. I need to go out and do grocery shopping or just go out with the guys and have men's club or whatever, like men's coffee club. They have a really hard time, even though the whole point of having that companion there is so that dad can get away. They really have a hard time. But once in this case, once, as an example, once your dad kind of gets a taste of freedom again, so to speak, then they're like, oh, this is the best thing ever. But it can take a little bit of an adjustment for everybody to get to that point. But again, with the right caregiver, all of this works out really, really well. They generally do not provide pet care, so they're not generally going to clean the cat litter. They're not going to take your mom's dog out. They're not going to clean up the dog stuff. They're not going to mow your lawn. They're not going to cut down trees. And their housekeeping, I mean, they offer light housekeeping. So that's basically just kind of keeping things tidied up. And running the sweeper, running the vacuum, but they're certainly not going to get down on their hands and knees and scrub the floors and pick up all the trinkets and dust perfectly. It's just, they're not there as a housekeeper. If you need a housekeeper, you need to hire a housekeeper. And we'll talk about housekeepers here in a little bit too. So this is the other question that comes up a lot is, what happens if dad ends up in the hospital? Do we lose the caregiver? And sometimes, yes, you do, because they have to be assigned to someone else, because these people need a check, right? They need clients so that they can pay their bills. So a lot of families don't always understand that. They're like, well, why can't Maria just wait until mom comes back home? Well, because they need clients so they can pay their bills. So typically the caregiver is reassigned, and maybe you can get Maria back, but maybe not. And so there again, we start all over again, because if Maria is now she's been assigned to someone else, or she chose another client, you may or may not get her back. And so then we have to start the whole process over again of adjusting to other caregivers. So the hope is always that you can get your caregivers back, but it's not always a guarantee. But the home care companies do try hard, because they are elated when they pair the right companions with the clients. That's their whole goal. That's their mission, is to be able to help seniors and vulnerable adults be able to stay at home. Geriatric care management companies or care coordinators or elder advocates are really important. And one of the reasons is this. I was doing a webinar a couple of weeks ago, so I was doing some research for that one. The World Health Organization in 2020 did a survey and found that 64% of nursing home workers admitted to neglecting and abusing their residents. So that's a high number, but I can tell you, because we do patient advocacy, we have a patient advocacy arm of Care Right, and I can tell you that number is way higher. Our clients that have an advocate that we work with have much, much better care outcomes than those that we see that they're laying crooked in their bed. They're calling out for help the whole time that we're there to see our clients, but we can hear someone yelling out for help because no one's addressing their needs. Or they're in the dining room, no one's assisting them in the dining room, helping feed them. And, so we know that our clients that we see as patient advocates, we know that they get way better care than those that don't have a patient advocate or family coming in to visit them. Care coordination is super, super important, because families don't understand. They're always blindsided by how much time all this care coordination takes. If you've just got even one parent and they have 3 or 4 doctor's appointments a month, because that's typical, it can take hours coordinating care, because then if the medications change, then you got to go to the pharmacy again and then repack the pills. And then, the doctor needs to see her again in a 2-week follow-up. I mean, this care coordination takes hours, and families are always surprised by that unless they have done it and they're like, oh, this is taking too much time, because this is stuff you have to do during normal business hours, right? And if you work during normal business hours, most of my clients come to me, they've already burned through all of their paid time off, their vacation days. A lot of them have already burned through their FMLA because of care coordination and hospitalizations. It takes hours. And if your loved one is in the hospital, especially if they have dementia or they're a vulnerable adult, someone has to be there, because otherwise they will likely not get the care that you would hope that they would. Same thing in long-term care. These people don't need to be local to clients. Like, that's important, because I work nationwide. I have families in 32 states, and we do care coordination and we do patient advocacy and obviously aging planning and family meetings. So I think one of the silver linings of the pandemic is it taught consumers that you don't always have to work with a company down the street. So it doesn't, none of these folks, except for the home care people, need to be like local to where your loved one is. Again, we talked about other resources like the Aging and Disability Resource Center. They're not going to take you by the hand and walk you through this whole thing. That's what we do. Is we do a white glove approach to help you understand all of these different options and put that aging plan in place. There's also state-run departments of, DHS and family services. But again, you're not going to be assigned to a care manager, case manager, and they are still operating bare bones. So I get a lot of families that are said, I tried to go through the county, but they're just not helpful because they don't have the resources. They don't have the manpower. And they're not designed to sit there and hold your hand and walk you through all this and be on the call with you at 7 o'clock on a Thursday night. They're not set up for that. That's what we do. Cash only hires, I want to cover this here because this is really important. So this is why it's bullet point number 1. So Marsha, you read my mind. So I cannot tell you how many clients that I have had since I started Care Right that they want to save money, so they don't want to hire a companion. They'll just use their housekeeper. So one story that I hope sets in your mind is this. So like 4 years ago, I was coming, it was a local family. So I was like, yeah, I'll come out to the house and we'll talk out to your house. So otherwise all my clients are virtual because they live across the country. So I'm walking up the sidewalk to my client's house, and all I can hear is the housekeeper yelling out the window, Annalie, I'm so glad you're here. And I'm like, oh, well, God, this does not sound good already. And so I get up to it. She's like already met me at the door, and I'm like, what's going on? And she's like, Dorothy is blue. And I'm like, what do you mean she's blue? And so obviously I run in and she is blue. And I said, what is going on here? So Dorothy wears oxygen, and the oxygen concentrator quit working at some point. And so when the housekeeper got there, she didn't know how to manage the oxygen concentrator, and she was trying to call the 800 number that's on the sticker on the front of the oxygen concentrator. This whole time, Dorothy is like blue. And I said, oh my, so I, of course, just automatically call 911 because she was blue. And I said, well, did you call the paramedics yet? No, I'm still on hold with this 800 number with the oxygen concentrator. So this is what I'm talking about. Like, dear God, please don't do this. Like, don't leverage your housekeeper. They're a housekeeper. They run vacuums, they mop, they keep the house clean. That's their skill set. And to put someone in that type of position who's not trained, who doesn't know what to do. I mean, the ambulance came and obviously they admitted Dorothy because she's blue. So the housekeeper had been dinking around with us for apparently an hour before I even got there. So do not ever just leverage the housekeepers. People need to stay in their lane, and housekeepers are great about oh yeah, whatever you need, I can help you with, but they get in over their head because they're not equipped for that type of tasks or that type of service. So, but this happens. You would be shocked at how often this happens. Well, I know my housekeeper, she needs more money. She just lost a client, so I'll just have her help me in the shower. Well, maybe the housekeeper isn't trained on how to do proper transfers. And so just, if there is one takeaway that you have from this webinar, please let it be this one and the camera. If you're hiring a caregiver yourself, like out of your own pocket, like paying them privately, remember you still are going to want to do a background check, the drug screen, the accountability. You're going to want cameras. You're going to want to train them on what your loved one's needs are. You're going to want to work out, like, depending on how involved you're, like, if this is a live-in care situation or whatever, you're going to want to offer some sort of benefit for them to be able to, you want it to be a long-term solution when it's the right caregiver. There's different payroll systems that you can use that are super affordable, and where they just submit a timesheet. So you want to do it above board because because it's the right thing to do. And most people want to stay on the right side of the IRS and the right side of the law, but you want to do it the right way and do it legit. A lot of people will hire neighbor Nancy and pay her cash, and then it can just get really ugly, especially if she gets injured, and you would hope that no one would sue, but people do. Or if she gets in a car accident, well, that's on you because I was driving your car. And so just, you need to be really mindful and watch what your liabilities are if you do go the route of paying someone out of your own, doing this type of arrangement. The other downside of doing this is that you still put yourself in the scheduler position. So if you hired, a couple caregivers and they end up pregnant or maternity leave or sick or vacation or whatever, move away, you're always having to figure out, okay, now who's going to come in and help mom for this shift? So you're still always the scheduler. And that's why this doesn't always work, because families don't have the time to do that. Always make sure you get driver's license, proof of insurance, because you become the employer, right? So you got to do this the right way. Adult daycare centers and programs. Again, I touched on this already, but it's definitely, these are lifesavers. These are really, really great programs. We have a shortage of these. I really think that we need many, many more of these, especially given the shortage of care workers. But it gives you as a family caregiver a break. Most of them don't provide transportation, and that's kind of the kicker. Is it's hard to get mom there if you don't live locally or if you work. Now, most of them, their hours are like 7 a.m. until like 5, but it just depends on what your work schedule is and who can get mom there if the center doesn't provide transportation. But it's perfect. It's group activities with other seniors or other people like them, which is really good. So they get little friendships made and they walk around the center holding hands. And they're so cool. And your loved one gets the meals, the snacks, they get exercises, activities. Again, I talked about this at the top of the webinar. They can do bathing. And they charge extra for that, of course, because that's an add-on service. But boy, is that a win-win, especially if bath time is a struggle for you at home. It's Monday through Friday. They're not open on weekends. And I do personally think that you get more bang for your buck, because if you go through a home care company, that's great. And you can use a layered approach. I have clients that do daycare like 2 or 3 days a week. And then they have home care coming at night after daycare, or the non-daycare days, and then that's when they have the companion. So you can do always a layered approach. There's always different solutions depending on what your budget is. Commission-based placements. We've got 5 or 4 or 5 minutes left. Commission-based placements. So these are placement companies. You've probably heard of them, but so that's all they do is they receive the commission from the facility. So say mom needs to go into a nursing home, or say mom needs to go into assisted living, these placement agencies, they have contracts with a whole bunch of different facilities. And so when families go this route, because families like it because there's no cost to the family, because the placement company gets the kickback, because that's what it is. They get the kickback or the commission, if commission sounds better to you. Same thing, they get the kickback from the facility. So the challenge with this is there might be a facility that's a better fit for your loved one. But if they don't have a contract with them, then they're not going to get exposed. You won't get exposed to that particular facility. Like we help families with determining their levels of care and what care options are going to be best for them in care facilities, but we do it more as an educational curriculum and teach you But what happens with these placement companies is they're just looking at that transaction. And then when your loved one runs out of money, if they put your loved one in a private pay only facility, your loved one's going to need to move out because they can't afford to stay there anymore. And what happens is sometimes adult kids end up footing the bill so that mom can stay where she's at because she's already adjusted and she's been there for months or she's been there for years. And so it's just, you just really need to make smart decisions. And if this business model makes sense to you because you don't want to have to pay someone to help you, then you just know what you get, what you pay for. There's no comprehensive planning at all. There's no aging plan. There's no meetings about now and what the future looks like. There's no making sure that you've got your grab and go binder that I talk about, the grab and go binder, and making sure that you've got your living wills and power of attorneys. And okay, what are we going to do now? There's no comprehensive planning and family meetings or anything like that. It's a transaction. Betty needs to go to a nursing home. Here's who we contract with. They have an opening, and then that's where Betty goes. The problem is when you realize that it's not the right fit, or that once Medicaid becomes a situation there, you're on your own. They're like, yeah, we can't help you. We only serve private pay people. The challenge is too that because we do about 30 facility matrix projects a week for families across the country. So we do all the market research. We look at the state surveys, the staffing ratio. Do they allow a camera? We gather all of this, how much private pay do you have to have before you can go on Medicaid? Otherwise, no point moving mom in a place if she has to have a year's worth of private pay and she only has like 16 months of it, right? So we educate families. And so the challenge is that, again, if there's not a contract with that particular facility, you won't get exposed to that facility. So just be a smart consumer and know what your options are. And a lot of facilities, they quit. I think they realize that that's kind of a slimy way to get residents, because what happens, their kickback is the first month's rent. So if it's a nursing home, the placement companies usually get about 8 or 10 grand, whatever that first month's rent is. That's what the placement company gets. That's their pay for helping place that person. And facilities don't really like that because they don't want to have to pay 10 grand, 10 grand to, they don't want to take care of someone for a month without pay. And so even when we do these projects for families, the facilities will say, we don't pay for referrals. And I said, no, that's good. Because I don't like that business model. I said, we work for the family. They're paying us to help them with these care decisions. So again, if they don't have contracts with those particular facilities, you won't get exposed to them. Evaluating a hired caregiver, what kind of level of engagement, how involved are they going to be? They'll do their best at developing rapport and trust. They try to train their workers as much as they can, but this is something that you have to evaluate. You need to be looking at the camera, provided you have a camera in there. You need to be talking to your mom. Mom, how's the care? What is the companion like? Are you feeling comfortable with her? Is she attentive to you, or is she always on the phone? What's her personality like? Is she patient with you? Does she help you stay connected? These companions should be FaceTiming you with your loved one. They should be able to help you electronically and video conference connect with your loved one so that you can stay in touch and be aware of what's going on. Language barriers are a huge thing, especially in our southern states. I have clients that, because they are so certain they want to age in place at home. And so they have companions coming in that don't speak any English whatsoever. And so they are on their phone. They have to be on their phone their whole shift because they are using an English translator app. So when I say you have to, if you really want to age in place at home, you really need to lower the bar of expectations, because this is what it's going to take. If you want to stay at home, then don't always expect that your care workers are going to speak your language and develop a rapport with you because they don't speak your language. So I know that's like a ton of information to throw at you. Hopefully you found some nuggets of information that were helpful for you. My contact information, you can always look at me, Google me on the internet, Annalee Kruger, Care Right Incorporated. We do aging plans, customized aging plans. and a ton of education for consumers so that you can make informed decisions. And then if content in this information or content in this webinar made sense to you and you want to learn more, you can always reach out to me, and Marche has my contact information as well.
Annalie, do you have time for 2 questions?
I do.
Okay. I wanted to make sure we got these in before we ended the webinar. And then if anyone else has a question, I can save the chat and we can reach out to you after today's event to make sure that those questions get addressed. All right, this is a really great one. What is your experience with a live-in caregiver? So for example, someone you hire that part of their payment is room and board.
I actually did that when I was in college. It was a great thing because I was broke and she needed care. And so the only thing I had to pay was my phone bill. And I just had to cook for her, administer her medications, get her to her doctor's appointments, and then help her with her bathing and showers and getting her tucked in at night. And we were best friends. So that's what I mean is when you find the right caregiver, it's such a rewarding experience for everybody, right? So so when you go through a home care company, not all home care companies provide live-in care because the wage and hour laws for that are different. And not everybody wants to do live-in care because, they have their own family. So if you go through an agency, sometimes it can be cheaper because it's kind of, you're buying more hours, right? So I have 2 home care companies that I use for my live-in people. I refer them to those 2 home care companies. One of them, the aide, stays for like a month. That's the arrangement that works for her. And then she's off for a month and then they send someone else. Which is nice because you really get to develop that relationship. Other home care companies, you have that live-in for like 3 nights or 3 days and 3 nights, and then you get someone else. And so it just depends on, what feels like the right fit. And the other thing too is just if you go that route, because this is what we talk about with our clients in the family meetings is, you need to make sure that you have, if the goal is to age in place at home and the money is there to support that, because again, this is going to be thousands and thousands of dollars per month. You need to make sure that you have a space for that live-in where they have privacy, where they have their own bathroom and they're obviously their own bedroom. But if they're going to live there, you want to make sure that they have enough privacy for their own self too. And that's really important to make that work. But again, cameras are a must in any case, whether at home or in a care facility. And long-term care insurance, so that we can't forget about that, right? Mm-hmm. So one of the things to think about, because the cost of live-in care can be, can be $8,500, $9,500, $10,000 a month if you just need one caregiver. But if your dad is like mine, for example, he's 6'4", and these caregivers aren't football players, right? They're petite little things. They're petite little people. They're so not like me at all because I take after my dad. I'm like gigantic. So, but most of these care workers aren't. And so if my dad had health issues and we wanted to keep him at home, for example, he's 6'4". So I already know that he would need 2 people to transfer him so that people didn't get hurt, right? Because we don't want these workers and your loved one to get hurt. So if he would need 2 people, that could be easily $20,000 a month just to keep him at home. So there's a lot you need to think about. So it's kind of a general question. So hopefully some of that response answered the question.
Yeah, I think that covers that one. This is the last one that maybe goes into some of this other webinars that we've done together. And so I would just refer this person to visit advicechaser.com. And we have a lot of archived webinars with Annalie about this particular topic. But I just want to ask the question, maybe you can just give a short answer here. So how early can you start planning? My parents are in their 70s in good health, but I'd like to start planning with them now.
That is probably that's probably the second most frequently asked questions is like, okay, this all makes sense, but when should we start having these conversations? And the reality is now, because we don't know if tomorrow dad has a stroke, what's the plan? I can tell you one of the reasons I started Care Right is because I worked in long-term care and always was doing tours with families. It was always the adult kids because mama had a stroke and she's a caregiver to dad with dementia. And the kids are like, we don't know anything about what they have in place. We don't know if they have long-term care insurance, their estate documents in order, if the dad's a veteran and the VA can help pay for this. So the answer is now is a time to start having these family meetings about the what ifs of aging, finding out what is the cost of care. Does mom and dad have a long-term care insurance? Is that policy that you can leverage? What's the elimination period on the policy? What does it actually cover? Did they upgrade to get, assisted living coverage, or is it only traditional long-term care insurance with, just it only pays for nursing homes? So now is the time to have these conversations. And I can tell you that families that work with me proactively, like in a situation like that, their family meetings are fun. There's laughter, there's joy, but most of the families wait until they're in crisis. They don't think about having these family meetings and putting an aging plan in place until they're forced into it with a crisis or caregiver burnout or a major condition change. And there's nothing worse as an adult kid of having to now take even more time off work to figure out what are the accounts, what are the passwords, who are the banks, who's dad's financial planner. There's nothing worse when you should be at the hospital or be able to take care of what you need to, but now you're doing all the stuff because trying to find documents and paperwork that you should have already had in place and had family meetings about. One of the tools that you'll find helpful is the grab and go binder. Literally outlines everything that you need to have in place. There's checklists behind each of the 11 tabs. This is a great starter kit for families who want to at least get their affairs in order and have the conversations. For example, there's 11 tabs. So the insurance tab, medical tab, funeral tab, those tabs work as a family meeting agenda item so that you at least have some idea of what you should talk about and make sure that everything is buttoned up. But the time is now to have those conversations.
Well, that's a great way to end. And Annalee, we want to thank you for taking your time to educate us. I want to thank our attendees for coming and participating in this very, I think, timely presentation, especially considering that we have an aging population. So really appreciate you taking the time to do this for us, Annalee.
Well, thank you, Marche.
To our attendees, look for a replay soon in your email, and you're welcome to send that with friends, family, parents. And it's a good place to get started. Here at Advice Chaser, we're all about helping you find a financial advisor who's a great fit for your life and your financial questions. Our matching service is free to you, and every one of our advisor partners has agreed to offer a free initial consultation to anyone we introduce them to. So find out more by going to advicechaser.com and clicking on the link to find an advisor. Once again, from Advice Chaser, thank you everyone for being here, and have a wonderful day. And we'll see you at another webinar soon. Goodbye, everyone.
Bye.